New Zealand in December last year passing a law that permanently bans the sale of cigarettes to anyone born in 2009 or after, essentially elevating the legal smoking age year after year after year. In 2023, children will need to be 15 years or older in order for them to buy cigarettes. The United Kingdom is looking to put in place a similar approach to legislation following the announcement by Rishi Sunak, the Prime Minister of the United Kingdom. Is this an approach that could work in South Africa? That's a question we're asking Dr. Sharon Nyatanza. Sharon is the Deputy Director at the National Council Against Smoking. Sharon, a very good morning and welcome to the show.
Good morning.
Is this going to work in a South African context? And perhaps you can shed a little bit more light as to how it's actually going to work.
Okay, so as you said, New Zealand already passed a law, and the UK is now looking to do the same. I think Malaysia as well, and even Australia, they're also looking to do the same. So one of the legs to that kind of approach is, raising the minimal legal age for buying cigarettes year after year. And the other leg to it is kind of reducing the number of permitted people who have licenses to sell tobacco. And the third one, which is also critical, is reducing the nicotine content, the addictiveness of the nicotine, which is what really keeps people addicted to cigarettes. So yes, so the approach there really from countries like New Zealand and the UK is that they've already implemented like strong tobacco control laws. And what they've seen now is that they now have reduced rates of smoking with the adult population and even with the younger population as well. So now they're really looking at what they're calling like the end game, where they're looking at a future where they stop the use of tobacco totally. So will it work in South Africa? There is a possibility for it to work in South Africa, depending on the context, depending on where we will be. It's not something that you just implement suddenly. As you can see, it's a gradual thing. So yes, as long as it's political will to protect public health, it could work anywhere in the world.
I've never been to New Zealand before, Sharon, but I imagine the population of New Zealand is a lot more observant of the rules of law, right? They, I imagine, as a society, are less antagonistic towards laws that are in place than we are here in South Africa. So you would need a society that, one, buys into the new approach as far as fighting the dependence on smoking is concerned, who will then adhere to the rules. I worry that in a South African context, we'll find a way of crooking the system.
No, that is a real concern. But I wouldn't say that it's because of Africans by nature. I would say it's really about the environment, and a big part of creating a conducive environment is enforcing laws. So I wouldn't say that it's because of it's not something that's in DNA, or it's not something that's really cultural. It really is about enforcing laws, and it does depend from country to country. Like you're saying, we see that from African countries, for example, they actually are African countries which already have very low smoking rates, without even having implemented strong tobacco control laws yet. So for me, it really is about enforcement. It's political. I think no society wouldn't want to protect its youth, because what we see with tobacco is that 7 out of 10 of people start smoking as kids. So some people, for example, have asked, what about stopping a 30-year-old from smoking? Yes, every approach, definitely there's always a downside to it. There's always an upside to it. But most people start smoking as teenagers, and we see less and less people starting to smoke at 25. We see it's a very low number of people who start smoking at 40. Most of them start smoking as teenagers. And the key to any public health approach into tobacco control has to look at stopping and dissuading those teenagers from starting to use the product.
Sharon, this is slightly out of your purview, I suppose, but we saw this during the COVID-19 pandemic, where there was a rise in illicit trade of illegal cigarettes that, one, are dangerous for one's health, two, deny the fiscus of any tax revenue. Are we not running the risk of seeing a spike in, I suppose, the sales of illicit cigarettes in the black market?
So definitely, that's a real concern. But I think when we look at illicit trade, we have to really clarify what we mean by illicit cigarettes. So during the COVID ban, we had a period where cigarettes were just banned immediately. And secondly, the government still allowed the cigarette companies, the legal cigarette companies, to still produce products for export. So illicit cigarettes in South Africa, what the economists at REAP have found, even the Hawks even reported on this, is that the majority of illicit cigarettes in South Africa are just undeclared local production. So they are products coming from legal factories, and they just have not paid tax. So the number of smuggled products or something coming up, from the back door, those are the minority in the illicit market, in that group. The main, problem is companies not declaring for tax. So the problem there is just securing the supply chain, because some of the products, for example, they are reported to be leaving South Africa for export. They never leave. Some of them, they do leave and then they come around. So we've heard about, legal companies, for example, sometimes oversupplying markets, knowing that very well those products will come back into the South African market. So it's about securing the supply chain. Kenya used to have the same problem. They've secured the supply chain by implementing what they call a track and trace system, where they really can track to see where is the product coming from, where is it going. And that really has helped in enforcing and in reducing illicit trade.
All right, we'll leave it there. Thank you very much, Sharon, for your time and your insights. Dr. Sharon Nyatanza is the Deputy Director with the National Council Against Smoking. Will this work in a South African context, do you think, where we decide on that line, that date, that year? Anyone born after that year will never be allowed to purchase cigarettes. Is it going to work in a South African context?